Hello, my name is Erin Jansen. I will be facilitating this workshop. The title of this workshop is called Discussing the Big C. I will try to provide accurate information about COVID-19, how it spreads, the different prevention measures, as well as detection measures. At the end of this workshop, learners should be able to identify symptoms as well as treat themselves at home if they have a mild case of COVID-19. I have provided an attendance register for the learners as well as learner guides. It is advised that the learners go through the learner guide as I go through the content today. The slideshow does not have everything that the learner guide has. We can now proceed with the workshop. Learners will be asked to participate in activities which are in the learner guides after every lesson. Let's move on to the content of today. Defining COVID-19. COVID-19 or the coronavirus is an infectious disease caused by SARS-CoV-2. This is a communicable respiratory disease which was first found in animals and then spread to humans. The first case was reported in Wuhan, China, and then spread quickly throughout the world. It should be noted that if you have a mild case of COVID-19, chances of you getting specialized treatment or hospitalization are very low. With that being said, it should be noted that the older population is more susceptible to getting COVID-19. This is because they have underlying conditions. With underlying conditions, it means that they have illnesses that can't be treated or need to be managed for the rest of their lives. This includes diabetes, chronic respiratory illnesses, cancer, cardiovascular disease, and many more. People with underlying conditions have higher chances of getting severe sickness and being hospitalized. The second lesson of the workshop will focus on COVID-19 symptoms. It should be noted that if you have COVID-19, your symptoms may range from mild to severe. We will now focus on the most commonly experienced symptoms, which are fever, coughing, sore throat, and fatigue, as well as shortness of breath. The others include fatigue, headache, muscle and joint pain, loss of smell or difference in your sense of taste, runny nose or nasal congestion, nausea or loss of appetite, diarrhea or vomiting. As you can see, there is another side to this, long COVID symptoms. Long COVID is when you experience symptoms of the virus long after you have been infected. These are the following: extreme fatigue, shortness of breath, heart palpitations and chest pains, problems with concentration and memory, changes in sense of taste and smell, joint or muscle pain. It should be noted that at first, COVID-19 symptoms can present as normal allergies or cold and flu symptoms. If you have more than 3 of the COVID-19 symptoms, it is suggested that you get tested. I will now be giving an activity to the learners where they need to tabulate the similarities between the symptoms of long COVID and regular COVID symptoms. Lesson 3 of the workshop will focus on transmission of the virus. Respiratory infections can be transmitted from all sizes of droplets of bodily fluids from an infected individual. These droplets can range from unseen micro droplets to the very visible droplets. A demonstration of this would be when seeing droplets is when someone coughs or sneezes but does not cover their mouth or nose. A demonstration of this would be the spray bottle. Say that this spray bottle is an infected individual. When he coughs or sneezes without covering, you can see the droplets go everywhere. This means that if someone does not cover their nose and mouth and is infected and uses common areas with you, this means that you can come into close contact indirectly or directly with their bodily fluids. When people come into close contact, which is 1 meter or less, with someone who is infected, the transmission can occur. This is because the healthy individual's eyes, nose, and mouth are susceptible and exposed to the individual who is infected bodily fluids. Airborne transmission refers to the presence of microbes within droplet nuclei, which are small particles which refer to the air that is around us, which remain for long periods of time. Airborne transmission can travel more than a distance of 1 meter. That means if COVID-19 is in the air, or if someone has used an oxygen mask who is infected and another one then uses it, it can be transmitted that way. And that is the end of the lesson on transmission methods of COVID-19. Now for the activity, can anyone tell me a transmission method of COVID-19?
Coughing and sneezing, or covering patients.
Micro droplets, seen or unseen.
Unclean and unsanitized surfaces.
Oh, thank you. You guys did a good job.
Thank you, ma'am.
Lesson 4 of the workshop will focus on the different prevention methods of COVID-19. It is recommended that people get vaccinated, and if they are unsure about the vaccine, they should inquire at their local clinic or healthcare provider. A physical distance of 1 meter or more should be kept from others even if they do not seem sick. Everyone should avoid crowds and spaces where there is close contact. One should wear a mask when in public. If the mask is made of fabric, it should be well fitted. You should also store it in a plastic bag that you keep with you when you need to take it off when you are in public. If you use a disposable mask, you should throw it away after one use. Your fabric mask should be washed after every use. People should sanitize their hands with alcohol-based rubs or use a generous amount of soap when it comes to washing their hands. In the event that one coughs or sneezes, you should cover your nose and mouth with your elbow like this, or with a tissue. You should dispose of the tissue if you have used it, and then wash your hands for 20 seconds with a generous amount of soap, or sanitize using 70% alcohol-based sanitizer. If you develop symptoms or test positive, you should immediately self-isolate. When wearing a mask, you need to cover your nose, mouth, and chin. When you are going to take off or put on your mask, you make sure that your hands have been washed or sanitized every time that you touch it. If a space in a venue is not properly ventilated, and there are people who are infected who have spent long periods of time there in close proximity, there is much higher risk of contracting the virus. Crowded indoor spaces where people are in close contact with one another, such as churches, clubs, fitness centers, offices, and restaurants, should all be avoided. To ensure that an environment is as safe as possible, one should avoid the 3 C's. Closed, crowded spaces that involve close contact. Lesson 5 of the workshop will focus on detection methods of COVID-19. There's a COVID-19 test called the PCR test, which stands for polymerase chain reaction. This is a regular swab test of the nasal cavity or throat, which detects genetic material from an organism like the virus. It tests for the presence of the virus at the time, but can also pick up fragments of the virus long after you have been infected. PCR test is a molecular test that analyzes one's upper respiratory specimen, which identifies RNA of SARS-CoV-2. PCR technology. This is when the RNA is amplified to create DNA, which is how the specimen is detected. There is another test called the antigen test, also known as the rapid test, because it only takes 15 to 30 minutes to process. The antigen test is when proteins on the surface of the virus are tested, which are called antigens. However, this is not the most reliable test. If a test like this comes back negative, a healthcare worker can ask to use a PCR test instead. It should be noted that this is the most cost-effective test there is, because the starting price is 240 Rand. The final lesson of the workshop will focus on the protocol to follow when you are infected with COVID-19. Let's first go over the general guidelines given to us. We should stop going to work and stop using public transport. We should self-isolate away from everyone for at least 7 days and monitor our symptoms to see if they get worse. If we need groceries, we need to ask someone for assistance or have them delivered to us. If we want to wash our clothes, we cannot do it at a laundromat. We need to ask for assistance or wait. This is because it is detrimental to expose everyone to your infected clothing. When you do wash your clothes, make sure it is at a temperature of 60 degrees or above. It is also recommended that your clothing be tumble dried. Now we'll focus on the personal guidelines you need to follow. If you are sharing communal areas such as kitchens or bathrooms, you need to disinfect after every use. You need to avoid sharing the same items in the same spaces as others that you live with. You need to isolate yourself for at least 10 days in a well-ventilated bedroom. You need to stay 1.5 meters away from everyone and wear a mask even when you are inside. Coughing and sneezing into your elbow or disposing of a tissue that you have used is recommended. When you have done this, you need to clean your hands with alcohol-based rubs or wash your hands for at least 20 seconds with soap. You need to strengthen your immune system by eating healthy meals, getting rest, staying active, and stop smoking. You need to take zinc, vitamin D, vitamin B complex, and vitamin C as prescribed from the doses from your GP. If you have pain or fever, you need to take Panado, and if you have a cough, you need to take cough syrup. If you do not have this at your disposal, you can gargle salt water, which is warm, at least twice a day. If you have a humidifier, make use of the humidifier by using eucalyptus. Or, if you have a steamer, you can use that. If you don't have any of the above, you can just use Vicks. If you are short of breath and you have trouble breathing when you are asleep, you need to try to sleep on your side. Or you can lay on your back but in an upright position. This helps with airflow. There are a few techniques that you can use to clear your lungs, but I will only be showing you one. The exercise I'll be teaching you to clear your lungs is the pursed lip technique. This is when you inhale through your nose and exhale through pursed lips like this. You need to do this for twice as long as you have inhaled. So if I inhale for 5 seconds, I need to exhale for 10. Let's try it together. This exercise should be repeated at least 5 times to loosen the mucus inside of your lungs. So now that we are nearing the end of the workshop, I'm going to give you guys an assessment to do, and you guys have to complete it now. So, you guys can now begin.
I'm finished.
Yes, we finished. Thank you.
Thank you. So now that we are at the end of our workshop, does anyone have any questions?
No, ma'am.
Are you sure you don't want me to explain something?
No, thank you. I think we've got it covered.
With that being said, there are refreshments in the kitchen, and thank you for coming to my workshop. Thank you for attending my workshop on COVID-19. I hope this information has helped you and that you can disseminate this information to others.